I'm going to start by grabbing all of my supplies that I'm going to need for my sterile dressing, since that's what I'm going to do first. I could grab everything for my sterile and my clean dressing at the same time if I wanted to, but I'm going to just do this first and then come back and grab my supplies for my clean. I'm going to come into my patient's room. Hello, my name is Kelly. I'm going to be your nurse today, and I'm just going to be changing your central line, okay? So dressing over that. First, I just want to identify my patient. So could you tell me your name, please? Okay. Miss Daisy Ray May. Daisy May Ray. Yes, check. And then your date of birth, 1/4/1945. Perfect. That's exactly what your armband says. So I'm just going to take a look here at our central line dressing. And it looks really good. Just right off the bat, I'm noticing that there's no redness, no edema. I'm just going to feel right over the top. No drainage here, and I don't feel any subcutaneous air. I could also check that though once I removed the dressing and had my gloves on. So first thing, we're going to go ahead, and before I take this off, going to ask if I can put a mask over you just so we don't breathe any germs on here. Here's your mask. Whoops. This could be a little difficult, so we'll just do that. Okay, and then I'm going to grab one for myself. I just brought an extra one in. So I don't have to open my sterile dressing kit just yet. So I can make that stay sterile for a little bit longer. Okay. Gonna grab some clean gloves. Okay. And we'll just go ahead and remove this dressing. A little extra sticky here, which is good. You like a nice occlusive dressing. Alright. Okay, that totally missed my garbage can. Alright, so we'll get that, and just making sure once again, if I'm feeling now after your dressing is removed for subcutaneous air, I don't feel any, but I'm going to make sure that I don't press directly on the insertion site. Okay, so I'm going to go ahead and remove my old gloves, and then we'll hand hygiene. I'm going to get my table here in position and my garbage can so that I won't really have to turn my back ever. I'm going to go ahead and get all my jewelry off. Okay. Right. Just because. So I brought an extra pair of gloves just in case. Just going to set those to the side. Just touch right on the outside there. Be a little tricky, but there we go. Okay. Alright, so I don't need this mask. Put that to the side. I'm just going to grab my gloves. And I'm not going to use my drape like this way. I have that right. Okay. Be sure to maintain that 1-inch border, but also being mindful of my sterile tray over there. Just touching the outside. Oh goodness. So So since I tore that, I would tell my instructor that I tore that, and so at this point I would probably need a new set of gloves, which is good that I brought my other set. Plan B. All right, here we go. I don't think that touched my finger, but I could go ahead and tell my instructor just in case they saw something that I might have missed. That rolled up just a wee little bit. These look super duper tight, but in reality when you have sterile gloves, the tighter they are, kind of the better, because you want it to be like a second set of skin. Okay. All right. So not perfect on my fingertips, but that's okay, because I can still grasp and have good dexterity. All right. Drape, since I'm sterile, just putting that to the side because I don't need that. Now we're going to grab my tweezers and my chlorhexidine here. Put that in my dominant hand. So I'd crack that, and then I'm just going to use this to hold up this. I'm going to clean for about 30 seconds right over the top. And then I'm going to start going circles around. While that dries, I'm just going to reach in and grab a skin prep. Okay. Just give that a minute to dry. And then I'm just going to put my skin prep not over the insertion site, but right around the skin that's going to be covered. Okay. Let that dry. Now, it's nice and occlusive. I know you want your mask off. I do too, Miss Ray. There we go. Okay. Okay. So I'm going to go ahead and remove my gloves. And hygiene. Then I'm going to date and label this. And then we will be all done. Perfect. All right. up, and I will now cover you back up. That's my sterile.